Yeah. Hello, guys. It is a bit loud here. Doki's advice again. We have reached LWAK, St. Elizabeth Hospital here in Siaya. Yes, I have Brian and Sister Mary here, who we're going to talk about the area and what is happening in this region. Just stay put and let's see what will happen. Yeah. Um, so let us try to get the mic. Yeah. My first question is, yeah, everyone has been asking where is LWAK and where are we exactly?
We are in Siaya County, Rarieda Sub-County, Asembo Central, where St. Elizabeth Mission Hospital is situated. And we are at the entrance of the hospital, St. Elizabeth Hospital, and I'm here with my colleague who's a radiographer. I'll allow him to say something.
Yeah, like you have heard, St. Elizabeth LWAK is a missional hospital found in Nyanza, Siaya County, Rarieda Sub-County, and Sembo Central. So LWAK is a nice hospital serving almost Rarieda people.
Our catchment area covers a population of 12,450 for this year. That is what we were given by the Ministry of Health for the year 2022 that will end next year 2023 June. So that is our target. And in this hospital we have different services that we offer. We have outpatient, inpatient, we have the laboratory services, antenatal services, CWC, that's the clinic for the children. Then we have the X-ray machine, and then we also have the ultrasound machine. And then we also have the CCC services. That's where the HIV patients get their drugs. We have a total patient of 2,952 at this particular moment. Those are patients who are on care. And in our MCH, or maternal child health care, in a week we have almost like around 100 children who come for immunization, and that is the first immunization, that is polio, and the BCG for prevention of TB. And then we have mothers also who come for the clinic for first NC, antenatal clinic, and we target 100 in a month, and we are always around 85, 90. That is the population we have for the NC. And then we have a pharmacy that is well stocked, that takes care of the patients. And our laboratory is the best in Siaya County. And when the Ministry of Health has visitors, they always bring the visitors to our hospital for benchmarking. At the moment, we are here with Daktari, who has come to be with us, and we are putting up a theater, hoping by the end of the year the theater will be ready and with the new wards. And we welcome Daktari with his colleagues to come and stand with us and support the people of Asembo, that is St. Elizabeth Mission Hospital. Our administrator is Sister Jenny Bori. She's not here with us. She's with the visitors in the office, and I'm the assistant. I assist on most of the things that happen on the ground. And today we are happy. We have received the machine, and I think Daktari should talk about it, how it will be important to the patients.
Yeah, now today, being that we have been using X-ray to diagnose chest problems like cardiac issues, now today we are receiving an ECG machine that will aid in diagnosing cardiac diseases. So we will improve on patients with cardiac diseases.
Above all, the fact that you have talked of the good things that happen in St. Elizabeth, we also have challenges. And our biggest challenge is that this community is under semi-arid, and most of the people are small-scale farmers. And when they are admitted in the wards, they don't pay their bills. The government has brought up a scheme, that is a national hospital insurance fund, that all clients or all Kenyans should use it to relieve them with the bills in the hospital. But even some of them are not able to pay the 500, especially those who are self-employed. Those who are employed, they paid promptly, but those who are not employed, they have a big challenge. And we are hoping that this machine that Tara has brought, the ECG machine, might help our old patients, because one of our common diseases around here is the HTN, that's hypertension, accompanied by diabetes, and I think that machine will help us to diagnose some of the conditions that have been coming the last minute. Then on top of that, we also have 2 ambulances that.
Before we talk about this, it broke my heart when I heard that we have everything in these facilities, but the ECG device was missing. So I remember asking our fans and followers to sponsor and to donate money. I want to thank everyone who donated in order for us to be able to bring this ECG device to LWAK, which is very, very far away from where we're living. It has arrived safely, and we're going to use it. The thing is, the cardiovascular diseases are the most deadly in the world. Yeah, so like lab tests, ECG has to be there, and we want to thank you for all your support, but we want to also remind you that there are still things missing here, like monitors for the next theater which is coming, in order to observe the patients after surgery. So let us keep looking and sharing and linking ourselves with other guys so that we can manage to fund all these things, that their people from LWAK and the area can get the best medical attention ever. Like she said, of course, the facilities, I underestimated while I was coming. I underestimated what kind of hospital this is, and I've seen how well they are organized, how keen they're taking care of their patients, and how attentive they are, and they're doing a great job here. And when you support them, you're supporting a great work, a great job here at LWAK. Yes, Sister Mary was telling us about the ambulances. I want to remind you the roads here in LWAK. I don't know if you can see it from the background. There are a bit of challenges, regarding roads and the places where the ambulances have to go to if they have to pick someone from home. It's not like where I come from. The ambulance has to be there within 8 minutes. Yeah, and here there are places you cannot reach in 8 minutes, even if you want to. Yeah, even if you have the best car in the world. So there are a lot of challenges which people are experiencing here, and the challenges like jobs and insurances. Like where we come from, everyone is insured. It is mandatory that everyone has to be insured. And here, everyone has to pay cash. So sometimes you go to the hospital and they tell you no cash, no treatment. Yeah, in the private hospitals, for example. And an ECG for a private patient costs like 8,000 Kenyan shillings. Yeah, this is something we cannot expect from our village people.